Okay, and so for our next session, will be on PACS, Post-Acute COVID-19 Syndrome. We have presenting Dr. Barbara George. She's a certified adult geriatric nurse practitioner, as well as a registered clinical exercise physiologist with over 35 years of cardiology experience. Dr. George, she also directs a multidisciplinary team of experts at the Center of Cardiovascular Lifestyle Medicine, which includes NYU Langone, Long Island-based cardiac rehabilitation program. Welcome, Dr. George.
Thank you, Morgan, and thank you, Selena and Calandra and Aaron and the rest of the Women Heart Organization for inviting me to talk about post-acute sequela of SARS-CoV-2 infection, or what is now being called PASC. Many of you on this conference are very familiar with long haulers or long COVID, but for the duration of this talk, I'll be referring to it as PASC. So if I can get to... Okay, next slide, please. I have no disclosures. Okay, so March 5th, 2020 is a day that those of us who lived in New York will remember, and it will go down in memory. Beginning in early March of 2020, New York, as everyone is aware, was the epicenter of the beginning of the coronavirus pandemic. And March 5th happened to be the first patient that entered into NYU Langone hospitals, and it happened to be the one that I currently work and live near. So we will forever remember that day and what has occurred ever since. At that time, just to put things in perspective, there were only 22 confirmed cases of coronavirus in New York State, approximately 160 cases in 17 states. And at that time, 11 people had died from the coronavirus nationwide. Next slide, please. So fast forward July 9th, 2021, and I took this data as of this past Friday. According to the Johns Hopkins University COVID tracker, there were greater than 2 million individuals living in New York who have contracted this virus, and approximately 53,000 deaths. So unfortunately, we have come a long way. And as many of you attending this conference are continuing to learn to triage and treat those acute cardiovascular risks of COVID-19, those of us in New York who experienced the first wave in March of 2020 are being inundated by hundreds and thousands of patients with persistent symptoms after an acute infection, known popularly as the long COVID. So these are just some of the words that my patients have told me over these last 16 months or so, for those that have survived the initial wave of the virus. I still haven't been able to taste any food. Every once in a while, I feel my heart beating really fast. I sometimes have chest pain and think I'm having a heart attack. I get short of breath climbing up just one flight of stairs. I never took naps before, and now I have to take a nap almost every day. And finally, I just can't seem to concentrate, and sometimes I forget what I was going to do, or what many of you have now heard is called brain fog. So Madeline talked about her personal experience, and I'm sure right now she's shaking her head many times over, because this seems to be a common theme for many of our cardiac patients coming back into our clinical practices. Next slide, please. So I'm just going to highlight one patient that I saw about a month ago, and it is really kind of a snapshot of who I see, not only as a nurse practitioner who has a lifestyle program, but also as the person who manages cardiac rehab. And we had a talk earlier about the Mayo Clinic's experience, and that is a whole other discussion about our experience in cardiac rehab. But this patient came to me and is a typical patient that we have been dealing with over the last 16 months or so. She's a 51-year-old female who was extremely active. She actually was a full-time social worker, very healthy. She does have a history of controlled hypertension. She had childhood asthma that was controlled, not requiring any medications. She was infected with the SARS-CoV-2 positive in November of last year with mild symptoms, not hospitalized, and was managed in the outpatient setting. However, her signs and symptoms prevented her from returning to work for over a month. And I saw her about a month ago. And at that time, she said to me, she has persistent extreme fatigue, shortness of breath, asthma exacerbation now requiring inhalers, suboptimal hypertension control, weight gain, disrupted sleep cycle, new onset snoring, daytime sleepiness requiring naps, and major anxiety. Her main concern was that she does not feel like herself, and she was really scared to resume any type of physical activity, given that she's always tired and short of breath. And her main goal was to return to normal so that she could do the things that she had done before. So this is really a very typical picture presentation that I see in the outpatient office. And I'm sure those of you that experienced COVID can attest to these types of very vague symptoms. Next slide, please. So long haulers, as many of us are familiar with, are long COVID, post-acute COVID-19 syndrome, or PACS, persistent COVID-19 syndrome. So these are all words that have been going around over the last year or so. But the most recent one, called post-acute sequela of SARS-CoV-2 infection, or PASC, is what the NIH is using to define this syndrome that we are now experiencing for the first time. Next slide, please. So PASC, by definition, this definition is a syndrome characterized by persistence of clinical symptoms beyond the 4 weeks from the onset of acute symptoms. According to the CDC, the term post-COVID conditions is an umbrella term for the wide range of physical and mental health consequences experienced by some patients beyond the 4 weeks after the initial infection, including patients like our patient who had initially mild or even asymptomatic acute infection. And this includes those long COVID symptoms that we have heard about, as well as multi-organ disease that has been affected by the COVID-19 virus, and the effects of being hospitalized and treated for COVID. Next slide, please. So here is a timeline of the post-acute COVID-19 syndrome, and the common symptoms observed are summarized here on the right-hand side. So the reported symptoms are encompassing both cardiopulmonary and neurologic complaints, including fatigue, which is the most common, palpitations, chest pain, breathlessness, brain fog, and dysautonomia. These symptoms can persist for months and can range from mild to incapacitating. And in some cases, new symptoms arise well after the time of the infection or evolve over time. Next slide, please. So this was a recent review that was published in May by Nassari and colleagues, looking at the most common, frequent, and variety of persistent symptoms among patients who have survived COVID-19. And what they found was the studies that have looked at the symptoms find that most patients experience at least one symptom, with dyspnea or shortness of breath occurring most often, fatigue, cough, atypical chest pain, depression, anxiety, sleep disorders, headache, and we go on and on. So current studies of symptom persistence is highly heterogeneous, and future studies need longer follow-up. This is a new virus for us, so we really don't know how to deal with the after effects of not only the initial infection, but also the complications associated with being treated for the disease. So the long-term effects, again, this is a second systematic review. It has yet to be peer-reviewed, but it also highlights that fatigue is definitely the driver in terms of what people are experiencing 16 months out. And if you look at cardiovascular symptoms, both reviews found upwards of 20% of individuals reporting chest pain, whether it's typical or atypical, 11 to 14% reporting palpitations at 60 days. Inflammation and the increased metabolic and myocardial demand are thought to contribute to these persistent cardiovascular symptoms, as this has been seen in other severe coronavirus infection cases like SARS. A rising number of patients and case studies are also noting a relationship between COVID-19 and what's called POTS, or postural tachycardia syndrome. And POTS is characterized by changes in heart rate with position, often accompanied with palpitations and decreased exercise tolerance. And it's been previously linked with post-viral other illnesses, but the exact mechanism is still unknown. So for women who are living with or at risk for heart disease, there is a lot of overlap in terms of presentation. And this is extremely important to be aware of, not only for your own health, but for the clinicians that are on the call here, because someone can present with shortness of breath and chest pain, and it might be related to their heart, but it might also be related to complications related to the COVID-19 virus. Next slide, please. So according to the CDC, the goal of medical management for post-COVID conditions is to optimize function and quality of life. And for those of us managing cardiac patients, we also need to be cognizant of incident cardiovascular complications following hospitalization with COVID. So where do we start and how do we manage patients, whether they're in a isolated COVID-19 clinic, which hopefully I have a feeling that's going to become more and more common. But those of us who are dealing in cardiology practices, we are having these patients present to us with not only their pulmonary and cardiovascular complications or complaints, but also with many other system-driven issues related to surviving the virus. So we have to be mindful of the fact that when some patients present with dyspnea or shortness of breath and require some oxygen, they also need to be worked up. So you might consider a 6-minute walk test or pulmonary function test, or anything that you would have typically done if you had not had a patient who had survived the COVID virus. But also be mindful of other organs that have been involved in this virus, whether it's thromboprophylaxis, looking at patients who are at high risk for developing blood clots or deep vein thrombosis, kidney function, and any kind of screenings for anxiety, depression, PTSD. These are all very common complaints that patients have that we are being presented with. It's extremely important to work with other disciplines to provide integrated outpatient care for survivors of acute COVID-19, whether it's in cardiovascular clinics or COVID-19 specific clinics when appropriate. And depending on the resources, prioritization may be considered for those at high risk for post-acute COVID-19, defined as those with severe illness during the acute COVID-19 and or requirements for care in an ICU. And just to give you another example, on the other extreme, we have a patient that currently is engaged in our cardiac rehab program who survived sudden cardiac death during his COVID hospitalization and was put on ECMO and intubated or on a life-saving equipment, and 2 months after being hospitalized is now in cardiac rehab, slowly regaining his strength and his function so that he can somehow get back to a new normal. Next slide, please. So the prevalence, features, and management principles of long COVID, with approximately 20 to 30% of outpatient individuals and up to 80% of hospitalized patients having persistent symptoms, we as providers and research need to recognize and manage the persistent burden and its impact on cardiovascular health for outpatients. Management can involve the combination of medical and lifestyle interventions, as well as recognition of the impact of long COVID on the ability to work, psychosocial well-being, and long-term cardiovascular health. And several speakers here talked about telehealth, and during the entire 2020 year, once we experienced the first wave, a lot of what I was doing was telehealth visits and really talking through most of the patients that I currently see in person, what they should be doing and trying to alleviate their fears. and at the same time trying to get them to continue with some type of healthier physical activity and lifestyle habits to keep them from developing or worsening their cardiovascular disease. Many have recovered slowly over their own through anticipatory guidance and light exercise, but the British Thoracic Society has established guidelines to follow up all patients regardless of severity at 12 weeks with chest x-rays and clinical assessments to evaluate any need for further testing. Next slide, please. So there is a role for some follow-up diagnostic imaging and other tests. Serial electrocardiograms and echocardiograms can be very helpful for patients, especially those that have symptoms like chest pain and shortness of breath, to differentiate between the after effects of the virus versus actual underlying cardiovascular disease. Cardiac MRI has been talked about, but it really is more on a case-to-case basis and should be a discussion with your clinicians, primary care, or cardiologist. Next slide, please. So about a month ago, I can say that NYU Langone Health has been one of two that have been awarded a significant NIH-funded research grant looking at the long-term effects of the coronavirus, or SARS-CoV-2. And what we know is that what we don't know a lot. So further evidence is needed to determine the burden of persistent cardiopulmonary symptoms and the impact of COVID-19 on long-term cardiovascular health outcomes. So a lot of research is underway to define the post-acute and long-term phases of COVID-19 and to distinguish health effects exclusively related to the infection of SARS-CoV-2 from consequences of hospitalization and from medical procedures and treatments required for care of people with severe disease of any etiology. The natural history of SARS-CoV-2 infection and COVID-19 related illnesses is the current area of investigation. The prevalence, type, duration, and severity of persistent symptoms following resolution of acute SARS-CoV-2 infection, as well as the risk factors associated with the development, continues to be studied. Next slide, please. So this grant that was awarded and we are co-leading is that one of the first things that we are looking at. It's called RECOVER, or long-term effects of COVID. And as you can see, recovercovid.org is the official title of the email or information that you can further get related to this new initiative. It is in its infancy. I have sat in on how women heart potentially could get involved in this, because what this initiative is trying to do is get out into communities and really learn from where people live, what their experiences were, how they can contribute towards understanding the long-term effects of COVID and how that can interplay with cardiovascular health. Next slide, please. So post-acute sequela of SARS-CoV-2 or PASC, the key points to know is that a large number of patients, families, and it's extremely important to bring in communities as well that have been affected by SARS-CoV-2. PASC is an umbrella term for a wide range of physical and mental health consequences experienced by patients that present greater than 4 weeks after their initial infection, and they can include patients who had initial mild or asymptomatic acute infections. One of the things that I would like to really make it important to recognize is that we need to normalize these symptoms, similar to what I was experiencing 35 years ago when I started looking at women in heart disease, is that we need to understand that this is real for our female patients, and normalization of symptoms is so important for patients to hear from their providers. Recognize that the shortness of breath is not in their head necessarily, or their anxiety that they're feeling is real. And once we acknowledge this and we work with our patients, we can really work together along with other disciplines to further understand and work out how we can best approach these issues. The entire spectrum of PASC is not well recognized. Being aware of the symptoms suggestive of PASC And objective lab and imaging findings should not just be used to assess a patient's well-being. The lack of lab or imaging abnormalities does not invalidate the existence, severity, or importance of patient's symptoms or conditions, and that gets back to normalizing what patients are feeling. The public health impact is unknown at this time. Next slide, please. Utilizing multidisciplinary, patient-centered approaches to optimize the quality of life and function in affected patients, setting achievable goals through shared decision-making, and to approach treatment by focusing on specific symptoms such as palpitations or conditions such as costochondritis. A comprehensive management plan focusing on improving physical, mental, and social well-being may be helpful for some patients. Understanding post-COVID conditions remaining complete and guidance for healthcare providers will likely change over time as the evidence evolves. And again, further research looking at risk factors, mechanisms explaining development of long COVID and preventive measures are imperative to prevent such a complication. And I just wanted to thank everyone. And this was actually a photograph that was taken this 4th of July, a big change since last July. But again, I thank Women Heart and those of you that have attended this conference and look forward to all of you in the near future.
Thank you, Dr. George.